Hey, I'm Nikhil from Developmental Biology and Genetics, IISc Bangalore. I'm interviewing Professor Annapoorni Rangarajan. She's also from the same department, Developmental Biology and Genetics, Indian Institute of Science, Bangalore. She works on breast cancer primarily, and there is a lot of incidence of breast cancer individuals developing diabetes. And this is the best platform to interview her. So that's why I'm asking questions to her. So what do you think over time? There's a lot of emerging factors from breast cancer to diabetes and diabetes to breast cancer. What do you think about this?
My laboratory is fundamentally a cancer biology laboratory, but of late we have got interested in recognizing that one disease may lead to the other. Both diabetes and breast cancer are epidemic in India and they are on the rise. So it turns out that the metabolic alterations, which is a common factor in both the diseases, could play for one disease leading to the other. For example, the hyperinsulinemia, hyperglycemia, all of these may make a microenvironment that is very conducive for oncogenic mutations to accumulate. This may trigger breast cancer. Vice versa, a patient who has breast cancer, who undergoes chemotherapy and other types of therapy, these therapy themselves may actually induce an environment which favors the initiation of diabetes. Thus, we need to have an interplay amongst the clinical fraternity of diabetologists and medical oncologists to treat these two diseases not as two independent diseases, but as one disease being able to contribute to the other.
So very nicely put up, and you led me to the next question. So what are the hurdles do you face? What I was going to ask you, and how with this kind of an environment where we have the clinicians and the pharma and also the basic science researchers, how we can put this together to solve the hurdles is what I was going to ask you, but you, I think, led there. So I will let you take over.
This conference has been a real eye-opener for oncologists, for endocrinologists, particularly diabetologists. And I can see a number of pharma company that has come up. Even this board here in front of me tells me there's a lot of interest in the pharma when it comes to clinical diseases, doctors treating diseases or clinicians. However, I find that when there is a majority of the conferences I've attended is of basic researchers, and I hardly see this amount of investment or interest from the pharma into basic research. It'll be fantastic if the pharma also comes and contributes in a large way, not only monetarily, but also intellectually, identifying the problems that basic researchers bring up, identifying the new inventions or new ideas that come up in these conferences and help the basic researcher take it forward. Right now, I see a lot of interest in the pharma in helping the doctors treat the patients. But ultimately, if the pharma comes up and helps basic researchers, we'll all together be able to make a better community.
Fantastic. So I was going to ask you later that with diagnosis and then later treatment, of course, pharma is one half of it. The other is engineering. And where do you think they fit in? And how do you think they would help for your research to solve the hurdles that you have?
Fantastic. Diagnosis is in part majorly guided by engineers, the kind of sensors that they help develop that will make it very easy for clinicians to diagnose the disease and then treat it. So some of the fundamental discoveries that basic researchers make, which when combined with engineering principles, for instance, in my own talk, I talked about PMUDs, something that I never knew as a basic researcher, basic biologist, but later, along with collaborative environment that is there in the Indian Institute of Science, with a lot of engineering community around, we got to understand that combining the diagnostics from basic research with engineers can actually lead us all the way in being very high up in not only being able to detect, but also cure the diseases.
So fantastic there. We have in IISc the tech, where the engineers are there. We have the basic science researchers who we are all doing exactly what we're doing. And we have the pharma, which is very close to us, and clinicians around us. But why IISc is something that you can probably allude on to.
IISc is this fertile ground. If you see it from the top, it's the green area. Somebody just outside was referring to a forest in the middle of a dry land. Likewise, IISc is also an extremely fertile ground for students to take up interdisciplinary work. My own laboratory has a student with Nikhil, as well as multiple other engineers, be it chemical engineers, all kinds of people in the institute. Their ideas, we like to ignite their ideas. IISc stands for basic research, but IISc also stands for cross-fostering of ideas. I think this is where IISc stands out very unique.
So in this platform, how do you think this conference can fit in, and what do you think we should do other than what we are already doing to take it further to the next level?
Thank you for asking that question, because by attending this conference, I myself got several ideas. Maybe it can be followed up as another conference in a couple of years' time, wherein we take forward some of the observations, we identify some of the speakers whose talks probably created a lot of discussion, and ask them and help them in the way in which they do science, and also ask them to come back and see where their thought processes are going. Something else that I thought would be very useful are small roundtable discussions, where students, the medical fraternity, the pharma company, and the basic researchers, they get together, and it's a roundtable conference kind of a thing, but then we are all put together and we take up a topic that came up as part of the conference, and then we try to address this problem. Maybe the best idea may be given a small incentive in the format of a small cash prize.
Thank you so much. Any take-home message that you want to give before concluding this off?
To continue these kind of multidisciplinary, multi-fraternity environment conferences, particularly it'll allow the younger generation, the Gen Z as they are called, to come up with even better ideas than what we have.
Thank you so much. Thanks for looking over this. And thank you very much, Professor Annapoorni Rangarajan, for answering all the questions. Hopefully we can do this more often. Thank you.
Thank you for having me here.